Welcome to the Art of Therapy. I'm Dr. Warwick Phipps. Together with colleague clinical psychologist Marizaan Koen, join us as we explore not just what therapy is, but how to do it more effectively, helping you deepen your therapeutic skills and elevate your practice one conversation at a time.
So lovely to be here and in our own studio as well.
Oh, it is. It's really exciting. First time we can really do and film and here, right here, where our therapy happens.
Where our therapy happens, yes. Yeah. So I think you're really looking today is looking at what makes therapy work and does therapy work, and then looking at what makes therapy work. So I think one of the first parts to look at is how important is the therapeutic relationship in a therapy process.
What you're asking, I think, is really important about what is the key aspect in terms of the therapy process, and obviously a number of keys. But if we just go back, your first part is what makes therapy work and does it work? So, of course, our centre's name is Therapy Works. In fact, now Treatment Works, because, of course, we know
Treatment works.
treatment works, yes. So how treatment is approached is going to make the difference. How we approach therapy, how we approach treatment. And a core consideration here is the nature and quality of the therapeutic relationship.
It's really about how people relate to each other, and that's where the importance of it is.
Yeah, very much, because how we relate, communicate, engage therapeutically, that's the basis, because all communication is in the relationship, and it's how we're communicating, how we're relating. And so that's the fundamental part, the basis of a therapeutic or treatment relationship. There's many techniques. As we know, you're a very senior therapist, psychologist. So there's any number of techniques that one can utilize, integrate. But that all rests on a really meaningful therapeutic relationship.
That really is the core of any therapy.
Yes.
Because when there's trust in that relationship, it makes a massive difference.
You know, without trust, how can we become vulnerable? How can anyone who's needing support really communicate and express what's happening? As we know, therapy's it's a very private, it's something of a sacred space, and trust is absolutely essential.
It really is the key.
It is, yeah.
If we look at trust, what is some of the aspects that really builds trust in a therapeutic relationship?
Well, yeah, it's interesting that you immediately know trust, because that really goes to a fundamental characteristic, and as we know, it relates to Carl Rogers' work and the humanistic approach, and his work specifically in the person-centered approach. And he identified the three characteristics of any meaningful helping relationship, and that isn't limited to therapeutic. He was saying any helping relationship needs to have three core qualities, and when that is present, someone can become more of who they are. They can express their own abilities, their own talents, their potential, and in effect self-actualize, which was the process of becoming more of who you are. So in order to do that, what he identified was that of the three characteristics or conditions that need to be in the relationship, the first is congruence. And it's beautiful that you identified and went immediately to how important trust is, because what congruence has to do with is trust. That congruence has to do with as we know, but we just explore this, that it's the how we communicate, what we communicate, when our verbal and non-verbal communication fit or are consistent, and our verbal and non-verbal are consistent to our relationship and our relationship over time. And when that's the case, what is happening is our communication is consistent, it's congruent. And the effect then for a client or patient is the moment they can experience communication is consistent and therefore congruent, it fits, communication becomes trustworthy. And so trust, our clients, our patients can trust what is being communicated and being expressed.
It's really creating that safe space and almost knowing what to expect so that they can really just be vulnerable.
Yeah. You know, the moment someone can feel safe, they can, and they know that what is being communicated is authentic, it's valid, it's trustworthy, in other words, congruent. Immediately with the trust comes safety. And so they feel safe, they feel secure, and now they can really begin to communicate and share their experience.
That also outcome, the therapy is also it's not social. It really has it has different qualities. Not always what people want to hear, but it's not social. These people can really be congruent and genuine in their communication.
Yes. You're a senior psychologist, therapist, and that we just know that, just as you say, people don't always hear what they want to and they hope to hear, but they can trust that what is being expressed, the feedback is really congruent, it's genuine, and it always is about their best interests. I noted earlier the three qualities. So the first quality being congruence. The second quality then, or characteristic for any helping or therapeutic relationship, is that there needs to be a deep understanding of another. And that deep understanding is something of stepping into their shoes or trying to understand something of their experience, which is empathy. And so empathy then is profoundly important in the therapeutic relationship. The other, and these are things that I think could be valuable, that we could explore as we go along in this series on what makes therapy effective, what makes it work. But just want to note the third aspect quality is relating to not only understanding another, the empathy, but the lack of judgment, the unconditional positive regard for another, so that whatever you express to me, I'm doing my utmost best to accurately understand your experience, to do so without any judgment, and in a way that what I am communicating, how I'm responding, is really authentic, congruent. Those certainly, that obviously those is key, and again, being able to communicate and share another's frame of reference without judgment.
These three that you just mentioned, they bring profound trust and support in any helping relationship.
Yes. Also, and that is also, I think, your experience, because you work with a very wide range of individuals. So it's children, adolescents, young adults, and older, and that it relates to the nature and quality of your own therapy, and also certainly that's something that I can attest to.
Mm-hmm. It's I go with that. I think it's something that we really, as psychologists at the center, that's one of our basic principles, and that you can really see clients flourish in those principles. and being able to work through difficult situations.
Yes, that's essential. And I think that's also why it goes to our values, that part of our values in the way that we relate, both in the therapy room, to anyone being here, visiting the center, in a way where it's person-centered, with the focus being on that person, and with authenticity, congruence, a deep understanding or trying for, the empathy, and without judgment. Yeah.
This is really nice to be able to look at the basics of the nature and quality of a therapeutic relationship, and that looks at why therapy works and why treatment works. So I'm really looking forward in getting more into it and looking further at some of these aspects as well.
Yeah, I share that. Just being able to look at it together, an aspect of therapy that's so often, and treatment is so often overlooked, as we just touch the surface here. And yes, looking forward to what we're going to be covering in the series,
Yes.
and looking at this in greater depth.